Okay. All right, and if anyone bops in late, just make sure they just type here when you get here. Okay, so we left off yesterday on these images. I did email everyone, last night. Hopefully, I put in the link to a veterinary dog skeleton purpose game that's very similar to this picture I'm showing you. This is the picture that I've always put on the test, and again, on paper I've usually given you a large word bank, and I don't always have you label every bone, but we're going to go through all these bones, and you would have to be able to label this skeleton. But the purpose game you can play over and over again, and it quizzes you. And then I also did give you a link to a Kahoot that I've played before, and I did put back a nervous system Kahoot that, like I said, nervous system will be on the final. I'll talk about the final later, all the sections that'll be on it. But again, so you can play, obviously the study guide is important. The Kahoot can help. It gives you an idea of questions I could ask. And then the purpose games helps you quiz over the skeleton. So hopefully that's given you enough resources to review. But what we're going to start with on here is I've already gone over the skull. Okay, so we've gone over the bones in the skull, the mandible, the maxilla, the ones I want you to know. Now we're going to first move to the vertebral column. And on this horse picture, I think it illustrates it better, is that it goes in order from cervical, thoracic, lumbar, sacral, coccygeal. So this is how, and every animal, they have the same names for the vertebrae. They have different amounts of vertebrae. So when we talk about the vertebral column, they are given abbreviations or shorthand. So the way we list it would be cervical is the letter C. And so we're going to talk about C and then a number of how many they have. And then we're going to go to T, stands for thoracic, L for lumbar, S for sacral, CY is coccygeal. Now coccygeal, let me grab something over here. Sorry, I gotta get my folder out. But coccygeal is the tail, okay? So when we get to the tail, we're actually going to be giving it that CY instead of just the letter C. Now, when we write out the vertebral formula, you need to write it in the order that it goes on the animal. What I want you to do is we're going to need to know the vertebral formula for the dog and the horse. So I'm going to type it here in the chat screen. Let me start with, it'll just take me a moment, sorry. I'm going to explain what this is. Okay, so what I've just written out for you in the chat screen is how you would need to write out the vertebral formula. And normally I say, so here I'm literally just telling you what I want. I would also ask you, what do those letters stand for? So you would have to tell me cervical, thoracic, lumbar, sacral, coccygeal. And then you would have to put the number. So what the formula is telling you is the dog and the horse both have 7 cervical vertebrae. Now, if you think about the size of a horse and the size of a Chihuahua, they have the same amount of cervical vertebrae, but obviously the size of a horse's cervical vertebrae are going to be much longer. And what's interesting is you see how long a horse's neck is versus the neck of a dog. So the structure of the cervical vertebrae are larger, but they have the same formula or the same number. Now, if you look at T, thoracic, the dog has 13 thoracic vertebrae. The horse has 18. Now, the horse has a very large thoracic cavity due to their lung capacity. I mean, horses have very large lungs, which helps racing and running, as they have a very, very large thoracic cavity to accommodate their lungs. Now, lumbar is interesting. The dog has 7 lumbar vertebrae. The horse has 6. So just the horse has 1 less, but that's because the horse has more thoracic vertebrae as 1 less lumbar vertebrae. Now, sacrum is going to be interesting. I'm going to talk about the sacrum. The sacrum was technically, in the dog, was 3 bones, but the sacrum fuses as 1 structure. But in the, so when you look at a sacrum, they're not 3 individual bones. It's 1 kind of chunk of bones that was made up of 3 vertebrae. So for the formula, the sacrum is a structure by itself, but you need to know that it was made of 3 vertebrae, and in the horse, it was made of 5. So their sacrum is 5, the dog is 3. Now, for the purpose of the formula, for the dog tail and the horse tail, I just put 20, because the dog, I want to say, will vary from 15 to 23, and the horse will vary somewhere, like, I've seen it in different books, different numbers, because obviously the length of the tail is going to be different. Now, if you have a dog that's had a docked tail, I mean, I have a boxer, his tail was docked as a puppy. If he had his tail, it would have a certain amount, but it is docked. And I will tell you, the spinal cord, okay, the spinal cord exits from the skull, goes through all of the vertebrae, but it narrows and it stops at about L6, L7. So really the spinal cord does not extend really past the sacrum, and it definitely doesn't go into the tail. So like if they break their tail, if you cut the tail, you're cutting between vertebrae, you're not damaging the spinal cord. And I will tell you, when you get into other classes, the reason understanding this formula is important is sometimes, let me go back to the image. Sometimes, now I'm just going to stay on the horse, but if we were to take an x-ray of a dog, and a lot of times the doctor says, I want a radiograph at like T13, L2, if we're looking for any issues. So we know that we would center our beam. Here's the last rib. So if you follow the last rib, that's about T13. There's L1, L2. So we will talk about junctions. T13, L1, L2. When I talk about epidurals in anesthesia, we give that at L7, S1. It's the lumbosacral junction. And that's because we're depositing the epidural at the end of the spinal cord where those roots emerge. But that's a landmark. You need to know you give it at L7, S1 and x-rays. And we radiated a Great Dane when I was in radiation, and his lesion was at C5-6. So my boss is like, we're going to center the beam about C5-6. So I felt behind his skull, and I could feel C1, which was the atlas, and then I kind of counted and tried to move my way down. Okay. Sorry, I just got that little your internet connection's unstable. So if I paused, I apologize. Hopefully we're just going to continue. Okay, so I've written that out. If there's any questions, I can always answer that. Now, when I've talked about this a little bit, I've already told you the processes of a vertebrae. The top one is the spinous. The ones on the side are the transverse processes. And then you have a body. And these would all line up with the next one. So these all need to fit together. The vertebral body is very much, is typically about the same on every vertebrae. The ones that look different are usually the transverse and the dorsal process. The vertebral body is pretty consistent. Those all line up, but the transverse processes will be different. Now, and I will tell you, when we talk about disc disease in dogs, when we're talking about a disc, right here at the vertebral body, this is where we would have that disc, that intervertebral disc, and then the next body would connect, and then there would be a disc. Let me do it this way, okay? So if this is a vertebral body, this is a vertebral body, in between is going to be that disc material. So in between each vertebrae, in vertebral body, there is a disc, and that's going to basically protect for any compression and that. So let's go. I've already talked to you about the processes. No, if I was talking about a dorsal process versus a transverse process. Now, what's the stress here is an articular process. If I call it an articular process, what is it doing? Does someone want to type it in? If it's an articular process, what does that tell me? Yes, so that means a joint. So now you're saying artery. Articular, artery is the blood supply, but the articular surface is it's all good. I love that everybody's throwing out answers, so no worries. It interacts with a joint. So if it's articular, this process would hook into the next one, and then they'd hook into the next one. So when they move, that's how they move together, okay? So remember, I said anytime you see the word articular, it means it's joining with another bone, and that's where it moves. Now, again, since I brought home a few bones, and I normally pass these out in class, what's interesting is normally all of the vertebrae bones just have a number, like C3 all the way down are just known C number, T number, but C1 and C2, which are the first two cervical vertebrae, have names. Number one is the atlas, okay? And this is where, again, you'd have the skull here, and I showed you that the other day, and then you'd have, here's my skull, okay? So this basically connects, and then this basically supports the head. C2 is called the axis. It has a very different appearance. So you can see this is the atlas, this is the axis. And it has a different spinous process, and it does not have those very wide wings or transverse processes. But I want you to know C1 is the atlas, C2 is the axis, AT comes before AX. So if that's how it can maybe help you remember. Atlas comes before axis. We call the connection between those the atlantoaxial junction. Atlantoaxial is atlas to axis junction. Now, because you're going to talk about diseases and issues later, in my Clin Med 4 class, like little Yorkies and sometimes Chihuahuas, but a lot of times in Yorkies, they have, when they're puppies, they have some instability, and it's called atlantoaxial subluxation, and it means anything that luxates comes out of position. So sometimes what happens is there's a weakening, and it's usually genetic, at But that is a very important spot because the brain stem and the beginning of the spinal cord are right under the atlas and the axis. So they can come in wobbly. In some cases, it can be fatal. We did this surgery when I was at Purdue. We would try to sometimes put pins and kind of try to stabilize the atlas and axis so that it didn't disrupt or damage the brain stem. So it's a very, sometimes what we'll do if it's not bad is we'll put them in like a body cast. If you've ever seen an old movie called Something About Mary, they had like a little terrier dog and the whole dog was in like a body cast and he was basically like frozen. His little legs were like this, but their head does not move. That's because what we're trying to do, in maybe not severe cases or the owners don't want to spend money for surgery, is if we stabilize them with a cast, our hope is that those bones will kind of grow or stabilize together on their own if we provide some stability. But like I said, I stress a lot of this because this is a potential issue in some of these really, really little guys. And then you'll talk about Great Danes and Dobermans sometimes get what's called wobbler disease, but their issue is in the lower cervical vertebrae. It's usually around C5 to C7. And it's a genetic disorder where they literally come in wobbly. And it's an issue at the lower cervical vertebrae. And it's a genetic as well. So you'll talk about that later in classes. So that's the cervical vertebrae. Thoracic, again, different numbers in the dog and the horse. You only need to know the dog and the horse for the test. But what's interesting is for every thoracic vertebrae, they have an equal number of ribs. So at T1, there's 2 ribs. T2, 2 ribs, okay? So if a dog has 13 thoracic vertebrae, how many ribs does the dog have? Amen. Good morning, math. So for every, and so a horse would have how many ribs? Everyone's seeing how fast they can type. Math, 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 fast. But okay, so if you get what I'm trying to say, if you look at this picture right here, okay, this has like a little divot, like where the head, so for every rib, the rib has kind of a little head to it, like the head of the femur. So it's going to fit into that little spot. And so when you inhale and exhale and your ribs move, they move like this. So for every thoracic vertebrae, there's ribs that are going to come out at each one. So we will get into the ribs next. Now, what's interesting about the lumbar vertebrae, the thoracic vertebrae has the most prominent dorsal process. So if you go down the back of a dog or a cat that you have at home, you can a lot of times count and feel at about the point of the shoulder, where the neck meets the shoulder is about where the thoracic vertebrae start, roughly. It's hard to feel the cervical vertebrae because they do not have, besides the atlas, they do not have a prominent dorsal process. So you have to kind of find C1 and approximately count, but about near the shoulder, if you feel between the shoulder blades, sometimes you can feel the dorsal process of the first thoracic vertebrae and work your way down. Once you get to lumbar, it doesn't have a prominent process, but the lateral processes are large and bulky. So I did not bring home a lumbar vertebral piece. But if I ask you, why are the lumbar vertebrae so large? Why are the transverse processes so large? They're basically attached to your back muscles and they support your abdomen. So the lumbar vertebrae have to be very strong because your thoracic vertebrae hold the ribs, but your lungs are airy. The heart doesn't weigh a lot. But when you get to the abdomen, they've got intestines, stomach, bladder, and if an animal's a little overweight, they're going to support. That's why people with back problems, they're like, you need to lose weight because your lumbar vertebrae are supporting your abdomen. So that's why the lumbar vertebrae are structured. Now, I told you sacrum or sacral vertebrae are technically one structure. Now, in the dog, 3 pieces fused, and in a horse, 5 pieces fused. So, but what this does is it forms the sacroiliac joint. Let me give you, okay, so this is my pelvis. Well, not my pelvis, but okay. The sacrum, this right here is the pubis. Now this is much lower. This is the ilium up here. It attaches, it's kind of hard to show you guys on here, but up in the middle here, the sacrum would be right about here. And it's called the sacroiliac joint, sacrum iliac, okay? So, and then if you imagine, if you feel on your dog's back and then you feel like 2 round bumps, these are the wings of the ilium. That's when you go down a dog's back and you feel, you're gonna, this is about L7S1. When I teach epidurals, and technicians can give epidurals. When I worked at Purdue, we were trained to give epidurals in anesthesia. So this can, it can be a technician procedure. One of the landmarks is you got to find the wings of the ilium, and you feel that on a dog's back, and then where about you put your finger, sometimes there's a little divot. Like on my dog, I can feel it. I can feel his wings, and there's a divot. Right about that divot is called L7S1. So that's the ending of the lumbar vertebrae, the beginning of the sacrum, and it's right about here. So I encourage you, and then you have your sacrum, and then you're going to have your tail go like this. So that's what we're looking at here. So the sacroiliac joint is where the sacrum attaches to the ilium, which is a bone of the pelvis. Now, the bones of the tail, like I said, they're going to vary in their appearance, and they're going to vary in number. That's why I don't have you necessarily know the range. It's going to be somewhere between 15 and 23, 17 to 21. I've seen, like I said, I've seen different formulas in different books. But all I want you to know, obviously, the length of those bones and how thick they are is going to vary. If you have like a dog like a whippet or a greyhound, and they got those whip tails, even a pitty, when we have like a happy tail, and if you've been hit by one of them when they're wagging their tail, at the end it can get very thin, and those bones are very narrow. If you have a dog like a Newfoundland, they almost use their tail like a rudder when they swim. The tail feels a little, it's thicker. So like, and then in different dogs, the structure of the coccygeal vertebrae are going to be different. And you can look at what happens is at the base, or at the, at the beginning of the tail, where it joins the body, the tail is thicker. And as you work your way down to the tail at the end, which is distal, it usually gets thinner. But one thing I want you to know, in the tail, the coccygeal vertebrae, there is no spinal cord. They do have nerve endings. I mean, obviously, if they hurt their tail, it's going to hurt. They can feel it, but it's not coming from the spinal cord. It's coming from little nerve endings that have extended on the more proximal part of the spinal cord at that L7S1. Again, the spinal cord's going to end at around L7S1. Let me just type that in because I want everybody to it actually ends about L6 to L7. So really, from the sacrum on, we're not dealing with the spinal cord. There are nerves, but not because of this, that we actually have a spinal cord in there. Okay, let's get into the ribs. So this is what a rib looks like. And if you can imagine, see in this picture, it has a tubercle and a head. So similar to like a femur, head of the femur. Remember, a tubercle is a point of muscle attachment. So the tubercle on the rib serves to allow muscles to attach. The main body of the rib, and then you're going to get to the end here, and the bone, and a rib is a flat bone. So it's considered a flat bone. The dorsal head articulates with the thoracic vertebrae. this is what I meant. If this is the thoracic vertebrae here, here's the head of the rib. When the animal inhales, exhales, inhales, exhales, this is articulating. So the articular surface is at the vertebrae. And then you're going to come down here. If we look at this picture, now this would be an animal on its back, and we're looking from the bottom. At the bottom, which is kind of our bone right here, this is called our sternum. We typically call this a sternum. It is a set of, they're called sternebrae. They're not really vertebrae, but they're called sternebrae, but they form the sternum. This is what we have at the bottom. Now the ribs would be attached to the vertebrae up here. The ribs are not a bone-to-bone connection. If you can imagine, if the ribs were just bone, how would the chest expand? It would be stuck to the sternum. Your chest would not be able to expand. So at the bottom of the sternum, there is a chunk of cartilage that extends, that connects from our sternum to the end of the rib. And it is called the costochondral junction. Costo means rib, chondro means cartilage. So it's rib to cartilage junction. So again, here is the rib, that's bone. The light blue there is cartilage, and then it connects to what's called our sternum or our sternebrae. Now, very important, there's two parts on here that you really need to stress and know. The most cranial part of the sternebrae, which would learn, sorry, my scarf's in the way because I'm cold. Up here, kind of we got this little divot in our neck. We can't really feel it like a bump, but the on a dog, if you go right under their neck and then feel under their sternum, you'll feel a bump there. It's called the manubrium. It's the most cranial aspect of the sternebrae. And that's a very good question for a teacher to ask. What is the most cranial aspect of the sternum or the sternebrae? That's the manubrium. The very end here, there's a little, and this is about where if a dog was on his back, and right about where his rib, his last rib in the belly, if you feel under there, there is a little bump, and it is called the xiphoid process. Now, I can't tell you how often I'm teaching about a surgical procedure or how to clip a dog, or a surgeon will say, I'm going to make my approach 2 centimeters caudal to the xiphoid. Well, if you don't know what the xiphoid is, then how are you going to know where to clip? So the xiphoid and manubrium are used as landmarks, sometimes for x-rays, surgical procedures, and whatnot. And the way I remember is M comes before X. Manubrium is cranial, xiphoid is caudal. Okay, and this is your sternebrae. Now, I may come back to that picture in a second. I've told you the dorsal end of the ribs, up at the top is bone, at the bottom it's cartilage. The connection is called the costochondral junction. So that's where bone and cartilage meet. And that's how, because remember, cartilage is strong, but it allows for some stretching. That's how the chest can expand and contract during breathing. If this was all bone, you wouldn't be able to expand the chest. Now, there are different names for the bones. I just want to explain this, is that about T1, 2, 3, 4, 5, 6, 7, 8, T1 through T8, you don't need to memorize that number, but if you can see, they are called sternal ribs because they attach to the sternum. Do you see how that cartilage attaches to the sternum? The asternal ribs are like 9, 10, 11, 12, okay? Those are asternal without sternum, do not have a direct connection to the sternum. Those cartilages attach to each other. It's like they can't reach, it's too far away. And then the last rib is considered what's called a floating rib because it does not have a connection to the rib next to it or to the sternum. So when you feel the last rib, if you follow it down, it's actually not connected there. Okay. So just something to understand is that not every rib connects to the sternum. The majority do. But again, if your dog or your cat, they're laying on their back, practice feeling them. You can count the ribs. You can feel underneath. Try to feel the xiphoid. Try to feel the manubrium. If you've got access to these animals, use them. And then I've already talked about the floor of the thorax is the sternum. And the cranial aspect is the manubrium. The caudal aspect is the xiphoid. And you need to know those two landmarks because we use them all the time to explain locations of things and such. Okay, if there's any questions about the thorax or the abdomen or thorax. Okay, everything that I just talked about yesterday and today were parts of the axial skeleton. The axial skeleton is the skull, the vertebrae, and the ribs. Okay, now, and technically the tail, because that's an extension of the vertebral column. Now we're going to talk about the forelimb and the hind limb, and we're going to start with the thoracic limb, which is the front limb or the forelimb up here. What's interesting is there is technically not a bone-to-bone connection. When we talk about, and this is part of when you have to label the forelimb and the hind limb of the horse in your lab exercise, the thoracic limb, the scapula, is attached on the lateral aspect of the thorax. It's kind of like floating on the side. Now there's a lot of muscular and connective tissue connections. Like the thoracic limb isn't just going to fall off, but it is not connected. Now in the hind limb, the pelvis is attached to the sacrum. So there is a bony connection to the hind limb to the axial skeleton. So that I just want you to understand the difference is the thoracic limb is technically a floating limb because it does not have a connection. The scapula attaches with muscles and tendons and connective tissue. Now, these are the bones of the thoracic limb that you need to know. And we're going to start at the top and we're going to work our way down. So the first bone, and this was, where's my scapula? Okay. So on us, this is back here, okay? And then the point, oh, I almost dropped it. The point of your humerus would fit right in here, and it forms the shoulder joint. But it is a flat bone, kind of a little bit like a triangle. This is very important landmark to know too. This is the spine of the scapula. Think about the spine on your back, but the spine of the scapula, which I explained the other day, is a point of muscle attachment. That's the job of the spine of the scapula. It is going to form the shoulder joint. Right here, you have something called the glenoid cavity. That's where the head of the humerus fits in. This bump, I'm sorry, it's right here, is that acromonium. Sorry, I'm pointing at the wrong. Acromonium is right here. Okay, a lot of important muscles attached to the acromonium, and this is how you move the shoulder, okay, by pulling your scapula. I probably know more about the shoulder. My son played baseball, had some injuries to his shoulder, but one of his issues wasn't necessarily an issue in the shoulder joint, was his scapula was not stable. He needed to build up those muscles because the movement of the shoulder is not just the humerus, but the scapula involvement. So he did a lot of exercises to build up the muscles of the scapula to give the shoulder more stability. So, in people, we're talking about the same bones. We're talking about very similar structures. So the glenoid cavity is the articular surface. The acromonium and the spine are points of attachment. And what I mentioned yesterday, the supraspinous fossa. A fossa is a depression in a bone. There's muscles that attach there and in the infraspinous fossa. And it's called the infraspinatus and the supraspinatus. So When we get into muscles, we'll talk about that. If we move our way down, the scapula connects to the humerus. Now, the humerus is a long bone. It's called the long bone of the brachium. Now, brachium is a term for forelimb. If I say brachium and I say anything about the hind limb, it's automatically going to be a false statement because your upper forearm is called the brachium. Your lower forearm is called the antebrachium. Ante means before. So your antebrachium, because usually when they talk about that direction, they're going this way. Antebrachium, brachium. Now, the proximal end, which is closest to the body, has a head. This is what fits into this glenoid cavity. And then the greater tubercle of the humerus attaches to muscles, and that's how we move the brachium or the forelimb. So that's a tubercle. It's a process where muscles attach. And then at the end of the humerus, or the distal portion, it connects to the radius and the ulna. But if you remember, we have the same bones, radius, ulna underneath. When you move your elbow like this, those two little things at the bottom, this one is called a condyle. They're like rollers. So what they do is they glide with the radius so that it will allow for the elbow to move, which is like a hinge joint. It's kind of like a door sliding open and closed. It's a hinge. The difference between, I want everyone to understand this picture says lateral epicondyle and then condyle. The condyles are the bottom, which are the rollers. Epi means above. So epicondyle is literally where muscles are going to attach to allow it to move. But the condyles are always on the bottom. The epicondyles are above. So that's the difference between condyle and epicondyle. And then here comes Bo trying to get into my bag of bones. You can't have those. Those are for school. They're not for you. He comes in here every day and he looks at those bones, thinks I'm going to give him one. Okay. Now, if we look at something called the olecranon fossa, okay, this is where it's going to be up in the shoulder. If we look on here, and it's not a great picture because it's in the back. In the back, there is a divot or a fossa. And what this does, this is our olecranon. Okay, so here's my humerus. Here's my humerus. In the back of my humerus, there's a divot. So when I bend my elbow, it allows the olecranon to fit in and move. So the olecranon fossa is how they connect and are able to hinge. So condyles are distal articular surfaces. Epicondyles are almost like knobs on the side. Epicondyles are not articular because they are above. So they're not touching the bone underneath. They're mostly up above the condyles. If that's confusing or you need, that's why I spent so much time on what's a fossa, what's a condyle, what's in a process, because these different bones have different parts to these. Okay, so again, you can't see it in this picture, but if you can imagine behind here, so here's the condyles, which are on the bottom, which are distal. Epicondyles are above like a knob, and they serve for attachment. And then behind here would be the olecranon fossa, because the olecranon is part of the ulna, and that is going to actually fit in there and move. So let's talk about the, hold on. Someone's sending me okay. All right, now the forearm or the antebrachium, which is lower, is made up of something called the radius and the ulna. Now the radius and the ulna are bones that are parallel. This is where I wish I had my skeleton in class, but the radius that I want you to know is the weight-bearing bone of the antebrachium. So when you feel in your forearm or in your dog, the very front bone here is the radius. They have a bone that runs parallel, and so do we, called the ulna. And when we take an x-ray of a dog, there's actually a gap between them. So they run parallel, but there is a gap. The ulna is what forms the majority of the elbow joint. And that olecranon process is the part that sticks off the back. That's what you feel right here. It is not weight bearing. It is primarily for muscle attachment. This becomes important later when you learn about, there's 2 other classes you learn about fractures, Clin Med 4, Animal Tech 6. But if a dog breaks the radius, we need to fix that usually surgically, like with plates or pins. But sometimes a dog might fall. I think like those little whippets and those dogs, you know, baby greyhound, holding them, drop them. And for sometimes they land, but sometimes only the backbone breaks, the ulna. If the radius is intact, it's going to act like a natural brace, and we don't necessarily fix the ulna. We might put the dog in like a bandage or a cast, but as long as the radius is intact, that is the one that bears the weight of the animal. The ulna is important for the shoulder or for the elbow, but it's mostly for muscle attachment and not weight bearing. But they are parallel, meaning they run right next to each other. And you can see right here, this is the proximal end of the ulna. This is the distal end. There's a process here for muscle attachment, trochlear notch, anchineal process. This is all very important parts of the elbow, okay? But the most important part is the olecranon. And this is what forms, and you can feel this on your animals at home. You can actually feel that process in the back. Now, if we're working our way down to the carpus, which is equivalent to our wrist, we don't say wrist in animals. It is called a carpus. It is made up of 2 rows of bones. I'm going to stop a second. Did you guys lose me? I got that little message. Okay. Yeah, it's just as long as, okay. So there's 2 sets of bones. What's interesting, and you got to think about this, obviously I don't have this to show you in front of me, but there's ones in the front and the back. So if we think about looking around the carpus, this top row is going to go by names. This row is going by numbers. I want you to mainly know that the carpus is equivalent to our wrist, 2 rows of bones, and they are short bones. These are those little short bones, and they are compact together. Now, this is what I talked about when week 1, when we talked about the knee. Because a horse leg is so long and it has a different structure, when a horse bends its front leg, it looks like a knee. It is technically their carpus or their wrist. But in a horse or a sheep, it is common to call it the knee, but they're always talking about the front. Remember, I told you the back is always the stifle. The front is called a knee only in horses and sheep. You could probably say it in cows, but they don't bend their leg a lot. So now I'm going to talk about these names, and I'm going to spend a decent amount of time on this picture. And it may look confusing, but I'm going to explain it. The metacarpal bones are very similar to the metatarsal bones. So I spend more time talking about this when we talk about the back leg and we talk about the metatarsals, and then we get into the phalanges. It's a very similar structure. So you're just going to replace carpal with tarsal. So a lot of these bones are going to have similar names, but tarsal is always in the back, carpal's in the front, C comes before T. Okay, I said if we start at the top, the first row of carpal bones has names. The radial carpal bone connects to the radius, would be right here. The ulnar carpal bone connects to the ulna. This and this are going to articulate with the distal radius and the distal ulna, if that makes sense. There's one, it looks like it's floating over here. This is behind. So they're just pulling it out so you can see. But this would be behind the radia and ulnar carpa. There's an accessory carpal bone. That's the first row. Those three are the first row. The second row is first, second, third, fourth metacarpal. One thing to understand, when we number metacarpals, phalanges, you number medial to lateral. Like if sorry, let me back up here a minute. If I was standing like this, our thumb is called P1 or phalange 1. This is 2, this is 3, this is 4, this is 5. It medial to lateral. So obviously this carpal bone that's low is going to be carpal 1, carpal 2, carpal 3, carpal 4, medial to lateral. Okay, those are the bones of the carpus. The metacarpals are these bones here. Sorry, right here. This is equivalent to our bones of our hand that is right here. Okay, so here's our carpus, here's our metacarpals. Metacarpal, you have metacarpal 1. That's this bone right here. Okay, this is metacarpal 1, which connects to our thumb. Metacarpal 2, 3, 4, 5. Okay, so there are 5 metacarpals. They are medial to lateral. Now, horses, and I'm going to get into this. I want you to know dogs and cats. I'm going to focus more on dogs, cats, and horses. But dogs and cats have 5 metacarpals. A horse only has number 3. So right here in the middle, if you look where a horse bends his knee, that part is 1 metacarpal on a horse limb. Okay, so that's what this says means, is a horse. Now, when it says they have 2 vestibular digits, in class, I have horse legs at school. They're large models. If we looked at it, a horse has metacarpal 3, but then it has 2 bones on the outside that are called splint bones. They think that the splint bones were leftover digits, metacarpals 2 and 4. It's part of your exercise in your lab book, which is labeling the horse limb. You're going to see there's sometimes in the reading they are called splint bones. Splint bones were probably the leftovers of metacarpal 2 and metacarpal 4. And then they attached to metacarpal 3. And then a horse does not have metacarpal 1 or 5. Okay, so when I get to the little bit later, we show pictures of the horse limb. I will get into that. Now, so this is really spread out, but what I want to get into here is, oh, actually, let me go one more picture. I'm going to be coming back to that, don't worry. Okay, this was the radius. This is the carpus, or the knee of a horse. They're showing you right here, this is metacarpal 3. It doesn't say metacarpal 3 on the picture, it just says metacarpal. In a horse, we call that the cannon bone, and I will get into that. These 2 right here is metacarpal 2, because it's medial, and then we have metacarpal 4 because it's lateral. But they are also called splint bones, and there's no 1 and 5. Now, I'm going to get into these bones later, but it shows you here that the cannon is 1 large metacarpal, and then metacarpal 2 and 4. So the horse only has metacarpal 3. You don't need to know the cattle. Okay, they are technically 2, so they're a little bit different as well. I just want to do horse, dog, cat. Now, this part, since it's on here, let me go ahead and talk about it, because then I'll get into what the digits are. But basically in a horse, they have this one long bone called metacarpal 3. It is called the cannon bone. I do want you to know the horse names, because they will use, if you work in equine medicine, they will probably say cannon bone more than they're going to say metacarpal 3. When they go down to the digits, if you imagine I take away all my fingers, I'm not giving you a gesture. The horse is literally standing on its middle finger. Okay, so they have metacarpal 3, and they have this, they have digits 1, 2, 3. This would be their hoof. So that is what a horse limb is, distal to the radius. It is literally only 1 metacarpal and 3 digits, which I find fascinating, that an animal that weighs over 1,500 pounds is literally standing on the equivalent of a finger. Now, obviously, these bones are very large, but it's a unique design. But what I do need you to know is digit 1, which is called proximal phalanx, or P1, is the first digit. Digit 2 is the middle phalanx, or P2. And then the distal phalanx is P3. But they are called the long pastern, the short pastern, and the coffin bone. The way I remember the order, and I have a kind of weird saying for this that I would talk about in class, is imagine if you're shot with a cannon, the pastern or pastor is going to give a long speech, then a short speech before he puts the coffin in the ground. And that's how, I know it sounds morbid, but in school I had to come up with very weird or funny ways to remember things. And so if you can come up with a saying or something, but it goes cannon bone, long pastern, short pastern, coffin. Though obviously coffin is easy to remember. It's the most distal bone of the horse, and you put a coffin in the ground. The coffin bone is the closest to the ground. So, but then it was like, how do you remember long pastern, short pastern? So shot by a cannon, pastor gives a long speech before he gives a short speech, then the coffin is put in the ground. But that is the order, and I do need you to know those names. If I ask you on a test, I said the proximal phalanx of a horse is called, metacarpal 3 in a horse is called, distal phalanx in a horse is called. So that's how I want you to understand, is that those in the horse, those have different names. I know you've got to get to math in a second, but let me just illustrate one thing about, because I'm talking about the digits. In dogs and cats, okay, when we give, we've talked about the metacarpals, these phalanxes are our fingers, okay? So this is the metacarpal. Your finger has 3 parts. You got 1, 2, 3, okay? P1, P2, P3. When I say P, I am talking about phalanx. When I talk about digit, we are talking about all 3, okay? This is digit 1 is my thumb. My thumb, or this is digit 2, which is my index finger. Digit 2 has P1, P2, P3. Okay, it's not digit 1, digit 2, digit 3. When I say digit, it's pertaining to the whole, in us it would be the whole finger, in a dog it would be their whole toe, okay? So you have digit 1, digit 2, digit 3, digit 4, digit 5. Within a digit, you have P1, which is proximal phalanx, P2, P3. Now, where this comes into play And the little sesamoid bones are these little circular bones in between. Sesamoid bones, I call them sesame seed bones because they're tiny and round like a sesame. There are different sesamoid bones in the body. So like the patella is a sesamoid bone. The fibula is a sesamoid bone. The navicular bone is a sesamoid. So a sesamoid is a general term for a round, irregular bone. So sesamoid, think of sesame seed. Maybe that helps you remember. There's little sesamoids in between the phalanxes. I really want you to know how we number and how we order it. So again, P1, P2, P3. Now, when we talk, when an ungual process, an ungula is a claw, it's the hoof. Like an ungulate is a species that has a hoof, like a horse, a cow, a sheep. Those are ungulated species because they have a hoof. Let me give you an example. When we do a declaw, when we declaw cats, we are literally removing P3. We are taking that whole, not just the claw, you're supposed to cut here, okay, and remove this bone from this bone. So now a cat that's declawed would only have P1 and P2. The cat would not have P3. Now when we remove dew claws in dogs, the dew claw is that digit that is non-weight bearing. It's up on the limb. It's like equivalent to our thumb. So in this picture, if this was a dog, we would be removing digit 1 and we would be removing P1 and P2. Now, depending on the dog, sometimes they have only one phalanx for a dew claw, sometimes they have 2. If they have a longer dew claw, it may be, but it's not, it doesn't have P1, P2, P3. But dew claws, if an animal, like my dog has his dew claws removed when he was a baby, so he doesn't have dew claws on the back, he has them on the front. His first toe on his back foot is P2. So if P1 has been removed, or digit 1 has been removed, it doesn't change the numbering, if that makes sense. The next digit is still digit 2, digit 3, digit 4, digit 5. He just had digit 1 removed when he was a baby. Okay, so let me review so that everybody gets this concept. We've got metacarpals up here. We've got phalanges or phalanxes down here. They are numbered medial to lateral, so inside to outside. So the pinkies, these are our digit 5. Outside is always the higher number. Inside is the lower number. And then a digit pertains to the whole toe piece, toe 1, toe 2, for us, our finger. And then within that finger, you have 3 phalanxes or 3 phalanges. You have P1, P2, P3. Now, again, if we're looking at a horse, this would be, P1 would be the long pastern, the short pastern, and the coffin bone. So that's how this dog paw image translates to a horse limb. Okay, I'm sorry. I know I pushed it to 11. I wanted to try to get to the pelvic limb. When we do the pelvic limb and I get to the tarsal, I don't have to go as in depth because it's almost exactly the same as the the paw on the front, the paw on the back. The horse limb in the back is the same as the horse limb on the front. So the names are exactly the same. You're just replacing the joint, tarsal joint, and carpal joint. Okay, are there any questions that I can answer? I've unmuted everybody. In the email, let me just mention something real quick.